Hello, everyone. Welcome to Vargas Academy. This week's topic is anemia and nurses. This is created from a faculty's view to a nursing student's standpoint, how you would want to know the answers of anemia. I have some terminologies, clinical examples, questions that is commonly seen with the references on each slide. Feel free to email me if you need a PowerPoint presentation copy of the slides. I'll be happy to send it to you. Don't forget to subscribe my channel. This is just an initiative, no other purpose. I'm just sharing my clinical experience for over 32 years as a faculty and also a current clinical practitioner. I'm sharing my experience with my fellow nurses. No other intentions of developing these YouTube videos. This is just to help my fellow nurses to function very well in these test questions and also practice as a very effective nurse and nurse practitioners. Here we go. First slide is the terminology. These are the terminologies that we see in the clinical lab work. A lot of questions are related to MCV, MCH, GIBC, so you have to know the meaning of these. And also I have added clinical examples. So take your time and study. I'm not reading these slides for you. That's the advantage of developing as many slides as I can. So you will have enough time to review them and study them as you prepare for the exams, and also you can go back and refer them in the clinical setting. This slide tells you what the three mechanisms of anemia, and the three mechanisms are explained with categories, with the clinical examples. So this is an excellent review, and the reference is on the bottom. The pathophysiology of anemia is very important. Erythropoiesis takes place in the bone marrow, and then it is controlled by the stromal network, cytokines, and the hormone erythropoietin is the key word here. A lot of questions are related to retic count and normal RBC circulation days. A lot of students miss those, so make sure you pay attention to this slide. Key points for practice and exams. So what tests do we do normally to rule out anemia? CBC, CMP, and iron panel. Iron panel consists of iron, ferritin, TIBC, transferrin saturation. And we also check B12 and folic acid. We check thyroid functions and occult blood for stool and emesis, And additional testings will be like peripheral smear, hemoglobin electrophoresis, which is the gold standard to rule out anemia, and that is on the state board exams. We do CT scans, depends on the type of bleeding or the signs and symptoms. We do EGDs, colonoscopies to rule out cause. Older adults, it's the different signs and symptoms, cognitive impairment, dementia, blood pressure variations, and syncope. And the causes are also similar to that. In addition to the normal adult causes, they have dietary deficiencies and poor absorption related anemia. There is a link here that I have added, which is related to anemia. Practice these questions after you complete these slides. Practice them and make sure you are able to answer those questions. These are similar to what you see on the board exams. How do you diagnose as an APRN? What will be the approach in treating, diagnosing adults? This is listed from the uptodate.com website. Clinical presentation will include all of that: CBC retic count to rule out pancytopenia, reticulocyte count, and hemolysis. And MCV, low, high, and normal will be discussed in the slides later. Here's 2 questions to test your knowledge, and the correct answers are highlighted here. Here again, the same thing with iron deficiency anemia and macrocytic and microcytic anemia. Study this. Here's 2 more examples, clinical questions. Then we have acute and chronic anemia. And there are 4 classes. There's clinical signs and symptoms, and assessment findings are listed in the slide. And this is chronic anemia. Signs and symptoms are usually seen in the elderly patients. Tachycardia and respiratory rate, hypotension, and depends on the underlying causes. Other findings are also seen. This slide is just for an FYI. There is also chronic anemia. Macrocytic anemia, the acronym will be BIL, B12 deficiency, liver function impairment, low levels of folic acid and thyroid level. And macrocytic anemia, The two variations are non-megaloblastic and megaloblastic. And here's the clinical examples. Pernicious anemia is often seen on board exams. B12 deficiency. Common cause is intestinal malabsorption. Keep in mind, B12 is a water-soluble vitamin, so also called as cobalamin, and it's often seen in animal diet. So patients who are vegetarians, you want to pay attention to the signs and symptoms, nerve pain, neuropathic pain, fatigue, all of that. So pathophysiology of pernicious anemia is often seen on the pathophysiology exam. So key point is anti-intrinsic factor antibodies and anti-parietal cell antibodies are the key points here. So the intrinsic factor, which is a glycoprotein, and they lack that, and that's what's causing these deficiencies. So here's the details on how that combines. The cobalamin combines with the blood in the lumen and the terminal ileum, and where the intestinal absorption is occurring in. And then pernicious anemia affected by autoimmune antibodies, which direct them to the parietal cells, and the intrinsic factor, its binding site is in the small bowel. So the target hydrogen potassium adenosine triphosphate is targeted by these antibodies, and the dendritic cells in the gastric system is activated, triggering the CD4 T cell lymphocytes in the perigastric lymph nodes. This is a very detailed pathological finding, but intrinsic factor is often one of the answer choices you will see on the exams. Neuropathy, numbness and tingling type of pain. Patients often complain, especially the elderly patients, they complain of numbness, tingling in the fingers and feet. There are thousands of reasons for neuropathic pain. Could be cervical cause, lumbar cause, diabetes. So always check a vitamin B12 and folic acid if they complain. So the nerve damage is discussed here, the pathophysiology of the nerve damage caused by B12 deficiency. Make sure you study this. This is often seen in the board exams. Here's microcytic anemia, acronym is TAILS, thalassemia, anemia of chronic disease, iron deficiency anemia, lead poisoning, and sideroblastic anemia. And then we have normocytic anemia, MCV is at 80. Acronym is RAM, renal dysfunction, anemia of chronic disease, malignancy. How do you evaluate normocytic anemia? Purple smear, retic count, liver disease, screen for endocrine renal disease. We do anion studies. Later stages, we do bone marrow biopsies. Here's a clinical question related to anemia. Aplastic anemia is also seen often. The common cause is important: EBV, Epstein-Barr virus, cytomegalovirus, HIV, and parvovirus are causes. This is one of the common questions that students often get the answers wrong. Iron deficiency anemia is often seen in board exams and also in clinical setting. Very, very important topic. Here's a clinical question. Pathophysiology, study this slide carefully. There's just more information on iron deficiency anemia. I took my time researching on every area so a student can get a question related to anemia, iron deficiency. So this highlighted is often seen on the board exams. Okay, study this slide. Here's a sample question on hemolytic anemia. How do you approach anemia with the type of clinical lab work we do? Often we do a CBC. The first thing we do is CBC, which is cheaper, affordable, based on the results, hemoglobin, platelets, thrombocytes. we do other diagnoses. And we also look for MCV. And these are the examples. If the MCV is less than 80, you want to think of these diagnoses. If the MCV is between 90 and 100, you have to look for these causes. Above 100 is macrocytic, which is bigger cells. B12, MDS, hypothyroidism, liver disease, alcohol, and drugs. Kind of like a repetition, but it's a summarized slide. As APRNs, you must know these things. Additional test, hemoglobin electrophoresis is the gold standard for these anemia workup. And you have iron deficiency suspicion, you want to check the ferritin level. If you have to supplement iron, keep these things in mind. In children, we don't give cow's milk because it has less iron over breast milk. And cow's milk is harder for the body to absorb iron also. There are some food that will show up on these questions: tea and coffee, milk, and some dairy products. And grapes, corn, and sorghums are also interfere. And this gastric acid suppressive medications is also seen often on those questions to mislead students. So I put this in there for you. Here's an example for microcytic anemia and the likely cause of it. So try to answer that. And these are the medications often seen that interferes or inhibit iron absorption. So make sure you review these and keep that in mind if it shows up on the exams. And I conclude these slides with 3 verse from the Holy Bible. You are in this program, or you are in the nursing program, because God has a plan in you, and He will guide you through. Email me if you have any questions related to this, and best of luck with everything you do. Thank you.